Okay, so we're going to go ahead and get started. So we are physical. So we're the Physical Therapy and Balance Center, Ogden. Okay, so we're inside the Ogden Athletic Club. So spelled different because we are different. So if you're here with us live, we really appreciate you being here, and we hope that you share this with your friends and family who may need it. We know that there are some of you out there right now who are suffering, who need this information, and who probably need to come in and see us. So we hope that you'll enjoy this presentation here, and if you need some help, we really hope you give us a call, because we are here to help. So this is the Sciatica and Low Back Pain Seminar. My name is Josh LZ. Okay, and Frank will be running the chat. Okay, so if anybody has a quick question, you can just drop that in the chat and Frank will answer that for you. If you have kind of a longer question or comment, you can feel free to email us. We'll have our emails at the end of the presentation here, and we'll try to get back to you. Okay, well, let's just jump right in. So sciatica, so the sciatic nerve, okay, it's the biggest nerve in the body. It's the longest nerve in the body, okay? It starts, from your back and goes all the way down the legs. It divides into two nerves, okay? Pain in the leg or pain going down the leg is very often coming from the back, okay? So often it's a back problem. So whenever we have a patient come in and tell us they have pain going down their leg or if they have pain in the leg, we always want to take a look at the back. So here's a good picture for you. Okay, so here's this is a right leg, and this big yellow nerve that's coming down the back, that's the sciatic nerve. You can see here where it splits into two. So one of that goes down all the way down the back, one kind of goes in the front on the lower leg. Okay, so the sciatic nerve is kind of a combination of nerves. So you have your nerve roots that come from your back, that come from the spinal cord. Okay, so you can see here L4, 5, S1, 2, 3. Those come out as nerve roots, and then they kind of combine. They're kind of like highways that combine into one big giant highway into the big sciatic nerve here. Here's one more picture for you. Kind of shows the bony anatomy. So you've got your pelvis, okay, your sacrum, that turns into your tailbone, your femur here. So then you see that big nerve, the sciatic nerve coming down the back of the leg. Here we get a closer look at the vertebrae. Okay, so your spine. So here's the L4 and L5 vertebrae, and you have your intervertebral discs. And those nerve roots come out the side of these holes right here. Okay, so those nerve roots combine into that big nerve. So the very first thing we want to know is it pain, numbness? Is it tingling? Okay, those kind of indicate, whether or not it's a nerve problem or a nerve issue. So another thing we want to know is what makes it worse. Okay, if we can kind of narrow down the activities or the certain movements that make it better or worse, that'll kind of give us a really good idea of what's going on. Okay, so sometimes standing and walking makes things worse. Okay, some people have a hard time sleeping. We ask about different sleeping positions, whether you sleep on your side, on your back, on your stomach. Sitting, okay, yard work, housework, lifting, getting dressed, okay, vacuuming, okay, transitions, in and out of bed, in and out of car, running. Okay, so different activities that cause your pain, we want to know which ones are better, which ones are worse. Okay, the other thing we want to know is the pain, numbness, or tingling reproducible? Okay, that's huge. So if we can reproduce the pain, okay, that is a good sign. If we can reproduce the pain, then we can likely reduce the pain. Okay, so if it's reproducible, it's likely reducible. If we can provoke the pain and we know exactly what provokes the pain, okay, we'll have a really good idea of how to help you. The biggest mistake somebody can make who has sciatica or low back pain, okay, the biggest mistake you can make is to ignore it. Okay, you just, you kind of just, it's nagging, you just keep going on. That's the worst thing you can do. Okay, you want to get on this fast and get it taken care of. The worst thing you could do is ignore it. You don't want it to turn into a chronic problem. Okay, so what are your options? If you've got sciatica or low back pain, you can ignore it. It's the worst thing you can do. Okay, you can use oils, ointments, pain patches, okay, medication, injections. Not that those things are bad. Okay, sometimes those things, temporarily can provide relief. Sometimes medications and injections are, sometimes those are necessary. They can help calm things down. Okay, but they don't get to the root of the problem. They don't fix the actual cause. Surgery, okay, we don't want those things. Okay, so you can do those things, or you can just come and see us. We can kind of figure out what's actually going on, get you on the right program, and get you back to doing what you want to do, get you back to life. So let's talk about some of the common causes of sciatica and low back pain, okay? One of the first very common causes is herniated discs. Okay, we probably all heard of that before. So here's another picture for you again of the vertebrae and the discs. Okay, so sometimes the discs can kind of, have some wear and tear, and you get some bulging here. Okay, that can kind of pop out and push on those nerve roots, and that'll send pain signals. You see those little arrows sending pain signals down the leg. Okay. The thing is, though, is 60 to 80% of people will have some sort of disc degeneration. Okay. I like to call it wrinkles on the inside. Okay. So if you took an MRI of me, you'd see stuff. Okay. If you took an MRI of 100 people, you'd probably see stuff in all of them. But just because there's stuff going on doesn't mean it's a problem. Doesn't mean you're going to have pain. So we always like to compare what we find on the physical exam with what shows on the MRI. In fact, we usually like to do our physical exam even before we even take a look at the MRI. Okay? Because a lot of times the physical exam is more telling than what the MRI shows. Okay, so we do our exam first, and then we kind of correlate that or compare that with what we see on the MRI. So herniated discs are usually a problem because of repetitive bending, especially under load. Okay, sometimes this can occur because of trauma. It's a bending problem. Okay, let's take a look at this table. This table right here is awesome. I love this table, and I want you guys to really pay attention here. Okay, so this is from a study that took asymptomatic patients, okay, so patients without symptoms or without pain, Okay, and of all ages, okay, you can see the ages here, 20, 30, 40, 50, all the way to 80. These percentages here are the percentages of these different types of findings on an MRI. You can see that even 20-year-olds, okay, if you took 100 20-year-olds, 30% of them would have some stuff going on, okay, but that doesn't mean that they have pain. It doesn't mean that that's a problem, okay. 30% would have some disc bulges, some disc protrusions, even in your 20s, okay. So that's why, like I said before, we always want to do our physical evaluation first and then take a look at your MRI and kind of compare the two. Sometimes your MRI will show, stuff on the left side, but in the physical exam, you'll complain of symptoms on the right side. So the MRI does not show the full picture. So that's why we kind of compare both. So really like this table here because that is really important to understand. The MRI is not the end all be all. Okay, so here's the different types of herniations. So you have this kind of thick outer ring of the disc. It's called your annulus fibrosus. And then on the inside, you have this kind of jelly-like fluid called your nucleus pulposus. Okay, you can see here, when you kind of get some wear and tear on the outside ring of the disc, some of that jelly stuff can kind of bulge out and kind of press on those nerve roots. Okay, if it gets really bad, sometimes that jelly stuff can kind of extrude and protrude out, and that's when it's kind of more serious. So here's a normal, nice looking disc. Okay, this one's got some wear and tear, and it's kind of bulging and pressing on that nerve root, and that's when you get some pain or numbness or tingling. So big question is, can you heal a herniated disc? Okay, and your favorite answer to those types of questions, it depends. Okay, it depends on how bad the disc herniation is. Okay, so you see kind of up here, you've got just some mild bulging, okay, here's kind of, it's more herniated. These have a better chance of healing, okay, and our bodies are resilient, our bodies will heal, okay, but sometimes if it's real bad, like here, down here, you can see it's totally protruded out and it's even pressing on the spinal cord itself. This one here, the jelly stuff has kind of totally come out and pressed on the nerve root and the spinal cord. These types of situations are more serious, and that's kind of when you'd be more of a surgical candidate. Okay, so we talked about herniated discs. The next thing we're going to talk about is stenosis. Okay, some of you may have heard about this, some of you may have not. Okay, stenosis basically just means narrowing. Okay, stenosis means narrowing. So this happens as we age. Okay, so the holes where the nerve roots come out of the spine, they get smaller. Okay, we get some narrowing as we get older, and that's a normal part of aging. DDD stands for degenerative disc disease. Okay, that's kind of the same thing. Our discs they kind of shrink. They get smaller as we age. Arthritis kind of goes along with that. Okay, this is just kind of aging stuff. So this type of stuff usually happens after 50 plus birthday cakes. After you've had 50 birthdays, start seeing a little bit more of this type of stuff. So with these types of diagnoses, you'll kind of have more pain with standing and walking. Sitting is usually better, okay? Because sitting, those nerve root holes are more open, okay? So the nerves can breathe a little bit better. Okay, you might also notice that you're going through the grocery store and it's been a little while, your back starts aching and you like to kind of lean forward on the cart because that kind of eases the pain. Okay, that's a sign that you might have a little bit of narrowing going on. Okay, so we have two pictures of two spines here. Okay, one on the left, one on the right. For just a quick second, I want you to kind of take a mental vote in your head, I guess, of which one you feel like looks better. Okay, so we got this one on the left here. This one, you can kind of see those discs. You can see some disc bulges here. Okay, you can see the discs are kind of shrunken. You can see they're kind of bulging out. You can even see here, so this right here is the spinal cord. You can see that some of those discs are actually bulging out and pressing on the spinal cord. Over here, this one looks a lot better. You've got big, nice and tall discs, okay? Nice bright spinal cord here, okay? So, the funny thing is the person on the left is asymptomatic. They don't have any pain. The person on the right is the one that has pain. So, that is why we always compare what we find on the physical exam with what we see on the MRI, okay? Because just because we have normal gray hairs and wrinkling on the inside, like this picture on the left, doesn't necessarily mean it's a problem. Okay, it doesn't necessarily mean that we're going to have pain. Okay, the third common cause of low back pain or sciatica. Okay, sometimes you can have stuff coming from the sacroiliac joint or your SI joint. So here is a picture of your pelvis. Okay, so your sacrum is this bone right here, kind of turns into your tailbone. And your ilium, this is the top of your pelvis. So where those two join, that's your SI joint. So your spine comes down and your pelvis is the foundation that sits on. And sometimes you can get some SI joint irritation or some problems going on down here. So the thing is with the SI joint is it's commonly overlooked. Okay, so there's some specific tests that we can do to kind of rule in or rule out if the pain is coming from the SI joint. And the funny thing is that this can actually happen in all ages, okay? It's not like stenosis where that's more of a kind of an aging thing. SI joint problems can be in all ages. So some common complaints, you may have some pain right over that SI. You may have some buttock pain, some groin pain. A lot of times transitions are kind of hard. So getting up and down from a chair is when you might feel it the most. Okay, this can also be associated with bladder leakage. So successful treatment. Here, we like to use hands-on physical therapy, okay? We use manual therapy to kind of move the pelvis, get it aligned better, okay? And then we're going to show you specific exercises and stretches to help stabilize the pelvis and the back once we've got the joints where they should be, okay? And we do use modalities to kind of help calm the tissues down, calm the nervous system down. So traditional PT, okay, sometimes this is called Hummer PT, okay, so H-U-M, so hot packs, ultrasound, massage, Hummer PT. Sometimes that's what you think of, when you think of the traditional physical therapy, but we do things differently, okay? Like I said, we do the hands-on physical therapy. We do the manual treatment, okay? We kind of get the joints moving and back in where they should be, and then we teach you the right exercises to keep things nice and stable. And with this type of treatment, we see a lot more success, okay? We get to the root of the problem, okay? With the traditional PT, the ultrasound, hot packs, things like that. Not that those things are bad, okay? They can be helpful to help calm down the tissues like we talked about, but that's not going to fix the problem, okay? So with hands-on treatment, we see a lot more success. So let's kind of review. So you got three options, okay? You can ignore the pain. You can alter the pain, with injections, medication, stuff like that. or you can kind of get to the root of the problem and get it taken care of, get it fixed. If you're not ready to handle it yet, let me share a really cool statistic with you, okay? Like I said at the beginning, I know there are people out there listening to this right now who need our help, okay? Let me share something with you. This is really cool. So there was a study carried out by the Journal of Health Services Research, okay? They looked into patients with a new episode of low back pain. They found that using physical therapy as a first treatment strategy, that resulted in 72% fewer healthcare costs for the patient, okay, within the first year. Okay, 72% fewer healthcare costs. That's huge, okay? And that's just if you come and try us first, okay? Before the injections, before surgery, come and try physical therapy. We'll get you taken care of. Okay, so who's ready to get back to being active, getting back to life? So if you have any questions for us, please give us a call. Okay, 801-476-2000. Right now we are offering free 15-minute consult calls. So if you have any questions, give us a call. We'd be happy to jump on a call and answer a few questions for you. Okay. If you don't want to come in, or if you want to just shoot us an email, here are our emails. Okay, this is Frank's, this is mine, and we will keep an eye out for those and try to get back to you. Okay, if you do not feel comfortable coming in, we know that with all this COVID-19 virus craziness going on, some of you may not feel comfortable coming in. We are offering telehealth visits, okay? And even though we might not be able to see you in person, we can still do a lot of good just by hopping on a phone call or a telehealth visit, okay? So don't think that because of all the craziness going on in the world right now, there's no help for you or support. We are here for you, and we will find ways to help you. So if you have friends or family who would benefit from this information, okay, tag them, share this seminar with them, okay? Our Facebook page is Physical Therapy and Balance Centers Ogden. For the near future, at least, we will be doing these seminars, these Facebook Live seminars once a week, Friday at 2 o'clock. Okay, you can also follow us on Instagram. We're posting every single day on Instagram. We've got some good content there. Okay, we're physical.therapy.oac. So if you like this stuff, please give us a like, follow us. Like I said, share with your friends or family. And if you need help, please give us a call. We are more than happy to, like I said, even if it's just a quick phone call, a free consult, 15-minute consult, give us a call. We want to help. Just so you are aware, we are following the CDC guidelines. We're cleaning everything, sanitizing all the surfaces. We're wearing masks. We're only seeing one patient per therapist per hour and keeping everybody separated. But if you're not comfortable coming in and see us, please give us a call. Stay tuned because next week Frank will be doing a follow-up seminar to this one. Okay, so he himself has in the recent past he has kind of been struggling with some back pain, and he recently actually had to do the surgery route. So he was one of those cases where his disc was totally extruded and pressing on the nerve, and he ended up having to get surgery. So next week, he will be kind of talking about post-surgery life, okay, and what that's like. So stay tuned for next week. Like I said, every week, Friday, Facebook Live, 2 o'clock, we'll be doing these seminars, and Frank will be talking about that one next time. Thanks for joining us, everybody, and give us a like, give us a call.